All right, well, welcome to the third session of SowBridge. I'm Lee Johnston, moderator for today's session, and we're excited to have Dr. Corrine Bromfield. Previously to being at the University of Missouri, she was an agricultural animal care and use program veterinarian for the University of Illinois. She had responsibilities for oversight of the agricultural animals owned by the university and used in research projects. She's been interested in working with swine since high school, and she earned her undergraduate degree in animal science and her doctorate in veterinary medicine from the University of Florida. She's certainly looking forward to working with producers and veterinarians in the state of Missouri, and at least for today, she's going to work with folks around the country as part of SowBridge. So we're happy to have Dr. Bromfield here, and we'll turn it over to her to talk about identifying scours. So, Dr. Bromfield, the floor is yours.
Well, thank you very much. Good morning, everyone, or at least good morning for the people that are in my time zone. Anybody in the Eastern time zone, I suppose it's a good afternoon. So we're going to go ahead and get started and talk a little bit about identifying scours. And so I'm going to go ahead and click to slide 2, which has identifying scours up at the top of it. And so just to make sure that we're all on the same page, I'm going to be using the term scours to mean diarrhea in pigs. And diarrhea is the condition in which feces are discharged from the bowel, frequently and often in liquid form. So scours may or may not be pathologic, and by that I mean that scours, if it's minor, if the animal has some loose stool, some loose feces, then this may be a non-issue for the animal, and it may be causing them no harm. But in the case of piglets or some of our very virulent pathogens, scours can be a very, very concerning symptom, and something that we want to make sure that we keep it in mind, we keep it in focus, and we know something about what's going on. And so if you'll go ahead and click to slide 3, looking at these pictures, there's some times where it's important to know what is causing the scours. So to say that our pigs are scouring, or to say that we have scours in our pigs, tells us a little something about what's going on. It tells us that we have an abundance of feces being produced. It tells us that the GI tract has something going on with it, but it doesn't tell us exactly. It doesn't tell us that the pigs have an infection with E. coli, or it doesn't tell us that the pigs have had exposure to porcine epidemic diarrhea virus. All it really tells us is that there's something going on in the GI tract. And so as we look at these different pictures, there's 4 different pictures that you can see of scours, and each one of them is a different problem. And so if we treat them all as scours, if we treat them all similarly, we may or may not be doing the best thing that we could for our pigs. We may not get them back on track as quickly as we wanted to. So looking at these pictures, how can we determine what's causing the problem? And if we can determine what's causing the problem, then we can determine what's the best course of action to save our pigs, or to minimize the time for them to be sick and to get them back on track. And so go ahead and click to slide 4. So we want to be able to differentiate scours. All scours have the potential to lead to dehydration, to poor welfare, and possibly death. So our first line of defense treatment is often very similar. And so that first line of defense treatment when animals are scouring is to make sure that we're offering plenty of fluids and electrolytes to keep them hydrated. Keeping the pigs warm and dry is also important, and making sure that they have appropriate nutrition. And I say this, and I'm sure that everybody who's listening is nodding along, that yes, anytime that we have pigs that we're caring for, we want to make sure that they're warm and dry, and that they have appropriate nutrition, and that they have access to water, and so they can stay hydrated. So really the first line of defense for scours treatment is our basic husbandry skills, and the plans that we would be, or the protocols that we would be undertaking anyway. And so this is fantastic. This is great that, the first thing that we can do is try to make sure that we're appropriately taking care of them. But in some cases, we can speed the animal down the road to recovery if we offer appropriate treatment, or if we offer more specialized treatment. And so in the case of E. coli, where we have a bacterial disease, we might be able to treat with an appropriate course of antibiotics. And that may be antibiotics in the food, it may be in the water, it may be individual treatments. And so what I would like to point out for just a second is that during this presentation, I won't be giving you, or I won't be talking about the different treatments that one could make for the different types of scours that we see. Because as I don't have a veterinarian client-patient relationship with each one of the farms, I am not going to be the one who knows best about what's going on. But what I would like to point out with this presentation is that by having people who are in the barn understand and help identify the different types of scours that we have, the personnel who are in the barn, the personnel who see the pigs every day, are an amazing resource for the veterinarian who's going to come out and try and diagnose the problem and try and design a treatment plan for that farm. And so the personnel who see these pigs every day are really the first line of defense treatment for all these animals, for keeping them healthy. And so understanding the different types of scours that we can see will help to put that veterinarian's protocol in place in a manner that really helps their piglets, really helps their animals to get over this scour problem. And so the different treatments that we have listed on here, I've got antibiotics, supportive care, vaccination, or diet analysis. Depending on what is causing the problem, may depend on which one of these treatments or which one of these protocols would be best to put in place. And so let's click on to slide 5. And so I have listed here a handful of pathogens that cause scours in piglets. We've got E. coli, we've got Clostridium, both perfringens and difficile, and all three of these are bacterial problems. They cause an infection in the gut, and we'll talk a little bit more about them and how to identify them and see the difference between them. Then we move on to, I've got rotavirus, and I have a whole lot of what I call alphabet soup. PEDV, which is porcine epidemic diarrhea virus, PDCOV, which is porcine delta coronavirus, TGE, transmissible gastroenteritis, and all of these really fall under the heading of swine enteric coronavirus. And so both rotavirus and the swine enteric coronaviruses are viral problems that we wouldn't be able to use an antibiotic for, but supportive care or possibly a vaccination strategy or a different type of cleaning protocol is going to be very helpful in these cases. So being able to tell your veterinarian, I think we have rotavirus or I think we have E. coli can be very helpful in implementing an appropriate protocol that's really going to help these pigs get over their sickness. On the right-hand side, I've got Coccidia and Cryptosporidium, whipworms. These are all parasites that are going to be treated a completely different way. We've got Lawsonia, Brachyspira, and Salmonella, which are, again, bacterial problems, but they tend to affect our older pigs. And so as we look at here, there's a large number of diseases that could be causing problems in pigs. So if I just went out and said, well, I've got scours in my pigs, it could be any of these. Additionally, if we click on to slide number 6, there's a number of non-pathogenic causes of scours. So pathogenic causes of scours are infections, are something that has to get into a pig to do that pig harm, and then causes that problem. And non-pathogenic causes of scours, they're not an infection. They're not a cause of disease that as a veterinarian I can treat by treating that infection. Instead, they may be causes of disease or causes of problems that we might be able to modify through diet change or warming the piglets up. These are additional problems that we may need to keep in mind when we have rapid diet change or when we have the wrong levels of minerals in the diet or the diet composition is wrong. We may see the pig's GI tract or the gastrointestinal tract get out of whack and we may see fluids run through faster than we want them to. And so with all these different causes of scours and different treatments, it may seem daunting to appropriately figure out each time what is causing the problem. But there are some things that you can do to narrow down the likely causes. And this helps your treatment protocols to work best at the farm. So we're going to click on to the next slide. This is slide 7. Unfortunately, there's no number down at the bottom. Sorry, guys. But if you look at the top, this is identifying scours. And so when we're going through and we're identifying scours, what are the key elements that we're looking for? And so as a veterinarian, probably one of the first things that they're going to ask is, what is the age at onset, or what is the age affected? And this helps to narrow down some of the diseases that we're looking at, because based on the way that a pig grows, based on the biology of the pig may be susceptible to certain diseases at certain times. So by knowing that this disease is only affecting our 1 to 3 day old pigs, or knowing that this disease is affecting every pig on the farm, so our adult sows, our weaning pigs, our suckling pigs, that tells us a little something about the disease, and helps to narrow down the way that we can utilize our treatment. Appearance of the scour. And so this one, I've got this high on the list, appearance of the scour, because a lot of people like to look at what the pig is doing and sort of relate the appearance of how that scour is being formed back to a specific disease process. And while sometimes this does work, it's not going to work in every case. And probably the best way, if you're going to utilize appearance of the scour, is to look at it when it's first exiting the pig. So we don't want to look at necessarily the scour that is on the ground, that has been sitting on the slats for a little while, although that will tell us some information about how fluidy it is. We really want to look at it right as it exits that pig. And then who is getting sick? So if you walk into a room, a farrowing room, is the entire room getting sick? Do we only have some of the crates getting sick? Do we have a few pigs in the litter, or is the entire litter getting sick? Looking at the difference between how the disease is going through the farm can be helpful. And then, are animals dying from this? So this question veterinarians will look at as mortality. And we often look at both a morbidity and mortality reading. And so morbidity is how many animals are getting sick. So is this 100% of our animals? Is this 3% of our animals? And then how many are dying? If the pigs are getting sick and they're dying, then this tells us that it's a more virulent problem than some of the other things where pigs get sick, but then they get over it, as long as we're giving them appropriate food and water. If they are dying, what do the gross lesions look like? And so any vet that comes out is probably going to ask to do some necropsies on some of the piglets that are dying. And we'll talk a little bit in just a moment about how you can be very helpful in doing a necropsy yourself before the veterinarian gets there. And then finally, are there any additional clinical signs? So is there anything else going on outside of the diarrhea? Is there anything else going on that could point you in a direction of one disease or another? So we're going to go ahead and click on to the next slide. And this slide has the picture of a piglet in a necropsy position. And so if you're going to perform a necropsy, you really want it to be done soon after the piglet has died. The intestines are some of the first organs to break down and autolyze. They start to decompose. And so you may not get a lot of information from a necropsy that's more than a couple hours old, especially if the piglets are in a warm, moist environment, which we would expect that they're going to be if they're in a farrowing house. If, for instance, if they die at 9 o'clock at night and someone comes in the next morning to see them and finds that they've been dead overnight, that's probably not the best sample for a necropsy. The better sample would be the pig that died maybe a half an hour before someone came into the room. Unfortunately, you're not always going to know that, but looking at the pigs often will help you to determine whether or not they've died recently. And additionally, this can be very helpful because if your veterinarian is unable to get out to the farm for the rest of the day. If they're unable to get out to the farm soon, if you find piglets that have recently passed, then performing a necropsy and looking at some of the major gross lesions can help to give the veterinarian a little bit more information when they get out there. And so as you look at this piglet, if you're concerned about scours as your main cause of disease, then some of the areas that you're going to want to focus on are the GI tract, the gastrointestinal tract, and that's starting at the stomach and continuing on to the rectum. And so as I've got listed here, I have the order that you're going to find these things. The stomach is the first, it's a pouch that you'll find directly below the liver. The liver is in about the center of that pig, it's the brown organ, and the stomach is the white organ that sticks out just underneath that. And so looking at the stomach to see whether or not it has food in it, whether or not it has milk in it, to know whether or not this animal has been eating is important. And then from the stomach, as you enter the intestines, the first part of the intestines is the duodenum. It's a reasonably short section of intestines, and it's not terribly important that you know where the duodenum ends and the jejunum begins. It's more that the duodenum is the beginning part, the jejunum is the middle part, and the ileum is the final part of the small intestines. And this may help to delineate where some of the lesions are, if the lesions are throughout the small intestine or if they're focused on just the middle portion of the small intestine. That may be helpful in determining what is going on, what is infecting your pigs at the time. Following the small intestine, we've got the cecum, which is a small blind pouch. It looks a little bit like a thumb hanging off the end of the ileum. And then there's the colon, which I have heard referred to as the honey bun. It's a spiral colon. It's a round structure. You're going to see it in this picture. It's sort of underneath the liver. It's not very well seen. And then the final phase that we'll enter through will be the rectum, and that will lead to the outside. And so knowing where these organs lie will be very helpful in finding the organs when you're performing a necropsy. And so we're going to click on to slide 9. And slide 9, we're going to start talking about how to actually identify each of the different causes of scours. And we're not going to talk about every single cause of scours because we could be here for the next several hours at least. But I'm going to try and talk about the things that I find are most common in sow farms, or most common in a place where we're producing weaned pigs. And so E. coli is probably the most common thing that people have heard of. And there are normal, non-pathogenic E. coli bacteria that are found in the intestines of pigs at most times. The E. coli that lives there oftentimes doesn't cause any problems. However, there are certain types of E. coli that produce toxins or that have pathogenic factors that cause them to create a diarrhea in these piglets. And so E. coli scours, typically we're going to see kind of a pasty to a fluid diarrhea. We're going to see litters affected. So if you walk into a room, you may be able to pick out which litters are affected, but it's probably not going to be the entire room that is getting sick. And therefore, it's also probably not going to be the entire barn or the entire farm that is breaking with scours. You're going to be able to pick out discrete litters that are sick. These are typically the youngest pigs. So starting at 1 day and older, we can see diarrhea caused by E. coli. Piglets from gilt litters are likely to be more affected than from our sow litters because sows have had more exposure to E. coli over their lives, and they tend to pass along more immunity to the piglets. So if you go through and you notice that you've got 4 or 5 litters in a room, and you can check on whether or not these are gilts or these are sows, you may find that more of the gilts are affected, or more of the gilt litters are affected in this case. The intestines, if you do a necropsy, tend to be somewhat normal thickness, but you may also see them inflamed, reddened, possibly fluid-filled. And if you're going to test the the pH of the scour, if you test it directly as it exits the piglet, it's going to be alkaline. It's going to be 8 or higher. And this is from how the bacteria causes the diarrhea. The bacteria, typically at this age, we see an enterotoxigenic E. coli. So that's a toxin-producing E. coli. And that, by releasing those toxins, it causes the GI tract to secrete more fluid into the intestine. And that's what causes our diarrhea. So we do see this alkaline pH. We go ahead and click to slide number 10. And on slide number 10, we can see these are reddened and inflamed intestines. They may be normal thickness or they may be a little bit thicker. And remember, these are going to be best seen shortly after the pig has died. If it's been several hours, we're not necessarily going to see maybe the reddening of the intestines, or we might not see as well the thickening of the intestines because the intestines start to break down. If the pigs are dying rapidly or they're sick enough to warrant euthanasia, like I said, it's best to perform the necropsy shortly after they die. And this is a point where you can provide a lot of assistance to your veterinarian, saying that on necropsy, you have a lot of reddened, inflamed intestines in very young pigs. And so we go ahead and click onto slide number 11. We're going to talk about rotavirus. Rotavirus is a viral infection, obviously. It's in the name of the disease. And this causes a fluid diarrhea that may be yellow or gray. And this, we're probably going to see it in a full litter, or we may see it in the entire room. Because it's a viral problem, because it's a viral disease, it tends to spread reasonably easily. We rarely see it in adults. So more likely we're going to see it in our young pigs. If we've got a good vaccination program, then we're probably going to see it 3 to 4 days post-weaning. So when we remove the lactogenic immunity, when we remove the sow's milk from the piglets, typically our mortality is low. So the piglets that do get sick with this have a fluid diarrhea for a handful of days, and they tend to get over it. They don't often die if it's uncomplicated. If there's more than one scour problem going on, we may see more pigs dying from this. And again, with this one, the pH is going to be acidic because of the way that the rotavirus attacks the intestine. So we'll go ahead and click to slide number 12. And on slide number 12, we see some intestines from a pig that look very different from the previous intestines. These intestines are thin. If you had a newspaper, you could possibly read the newspaper through these intestines. So rotavirus actually attaches to the intestinal cells, and it destroys the intestinal cells, which makes them look this thin because some of the layers of cells have been destroyed. And because of that, the pig is unable to absorb the nutrients that were in his intestines. And so we're going to see a fluid diarrhea from this. And we're going to see a pH that's reasonably acidic. So we may see a pH of 5 or 6 on this if we were able to catch the scour right as it exits the piglet. But this is one of the classic signs that you're going to see, these very thin intestines. And these piglets, like I said, these are often young, but with a good vaccination program, we may not see the rotavirus problem until we remove the sow's milk from the piglet. We go ahead and click onto slide number 13 and talk a little bit about Coccidia. So Coccidia is caused by Isosporus suis, which is it's a parasite that's going to get picked up from heavily infected crates. And so the parasite, the eggs are shed in the feces and shed into the environment, and they're very hardy in the environment. They're very difficult to get rid of. Pigs don't show signs of this disease younger than 5 days of age because of the way that the parasite takes hold. So typically the youngest we're going to see is about 5 days of age, but more commonly we see infections in these pigs of 1 to 3 weeks old. And they're going to have a pasty or a creamy diarrhea, and they tend to have a rough hair coat, and they look gaunt. They don't look like they're doing very well. On necropsy, sometimes it's difficult to notice the gross lesions, or you may see thickened jejunum and ileum. And so remember, the jejunum and the ileum is the second and third parts of the small intestine. So we go ahead and click to slide number 14. And as you can see here, we've got some intestine that has been opened. And this is very different from the rotavirus intestines. You can't see through these. They're not very thin. They probably feel a little thick when you run your fingers over them. And then if you cut them open, you can see that we've got kind of this additional lining in there, and it's much thicker. In the opposite picture, you can see there's a small Isosceles suis. This would be something that you'd obviously have to have a microscope for or get your vet to run this diagnostic. And go ahead and click onto slide number 15. We'll talk about Clostridium for a short amount of time. Clostridium is a bacterial problem, and it's caused by either Clostridium perfringens type A or type C, or Clostridium difficile. And typically with Clostridiums, Clostridiums are very hardy in the environment, and they may be shed by the dam in the feces. Nearly all pigs who become sick with Clostridium will die. So this is one of those cases where our mortality rate is very important because we're seeing a lot of pigs getting sick and a lot of pigs dying. This tends to be either we don't see any signs of scours because the pigs die so suddenly, or we may see a bloody scour. So previous to this, we really didn't expect to see any blood in the diarrhea, but if we've got a case of Clostridium, we're likely going to see some blood in the diarrhea. In the case of Clostridium perfringens, we may see a handful of pigs in the litter, but not all pigs. In the case of Clostridium difficile, we tend to not find them sick, unfortunately. The most common presentation of Clostridium difficile is acute death. And so these are pigs, these are young pigs, starting at about a week of age, and it can continue up to 3 weeks of age with Clostridium. When we go ahead and click to slide number 16, these are gross lesions of the intestines of pigs with Clostridium. And you can see that these are so extremely reddened as to almost be black. So you may see a blackening of the abdominal skin on the outside of the abdomen before you get into to be able to see the intestines. You're going to see hemorrhage in the small intestine, and you may find gas in the wall of the intestine because Clostridium is a bacteria that produces gas. So these intestines may feel a little bit like bubble wrap. And again, these intestines look very different from a piglet that had rotavirus, which is very thin, or a piglet that had Coccidia, which would probably be thickened. So then we'll go ahead and click onto slide number 17. In slide number 17, I've actually grouped a handful of diseases together. And so these diseases, like I said before, this is swine enteric coronavirus, which includes PEDV, porcine delta coronavirus, and transmissible gastroenteritis. They all have reasonably similar presentations to the point that it does matter which one is in your farm if you're trying to do a vaccination program or if you're trying to get rid of this disease. But for the first couple days, it almost doesn't matter because you're going to treat them all the same way. And so these cause profuse watery diarrhea. So the diarrhea is very watery. You may not be able to see it on top of the slats because it's so watery that it runs through very quickly. You might see some vomiting with this. Typically, we don't see vomiting in some of our other diarrhea cases, but you will often see it in PEDV or TGE or Delta coronavirus. You're going to see a very rapid dehydration, and the youngest animals will be dying. And so this is a disease where you're going to see it. Your litters are going to get sick. Rooms are going to get sick. The whole farm is going to get sick. And so this is very important to keep in mind both ages of animals that are getting sick and how we're seeing the disease move, whether it stays to a litter or whether it moves throughout the farm. Because like I said, this disease is going to move throughout the farm. Additionally, we're going to see very thin intestines with these pigs. So if we click on to slide 18, we can see we've got some profuse watery diarrhea on the slats there. It may even be more watery than this to the point that we can almost not see it on the slats. And as you look at the intestines, they're very thin. They're very similar to a rotavirus intestine. The enterocytes, the cells of the intestine have been destroyed, have been eaten away. And so you can see through them. But typically with a rotavirus case, we don't necessarily see the disease spread throughout the farm. It doesn't tend to be as virulent as our enteric coronaviruses. Enteric coronaviruses go throughout the farm and go quickly. Click on to slide 19. We'll talk just a little bit about hypoglycemia. So hypoglycemia is the first disease we have on here, or the first problem we have on here, that's not caused by an infection. It's caused by the pigs not getting enough nutrition. And so we're typically going to see litters get affected with this. The entire litter may be affected, but you'll also see additional signs in that the pigs are weak, they're inactive, they may be paddling or seizing, they may have central nervous signs because they're not getting food. And they're not getting food because mom has either mastitis or agalactia, she's either not producing milk, or she has an infection that is causing her to produce less milk or allow the pigs or disallow the pigs to come and get nutrition. So again, this is going to be litters of pigs. We're not going to see it throughout the room. And when we do a necropsy on these pigs, we're going to find no food in their stomach. So they haven't actually had a chance to get any food and to have that full stomach as we expect in our other cases. Go ahead and click onto slide 20. In slide 20, we talked just a little bit about cold stress. Cold stress can be a primary cause for diarrhea when a piglet is severely chilled. However, most of our farms, most people that work with piglets understand that piglets need to be warm. It's one of the basic tenets of raising piglets. And so it's unlikely that cold stress is going to be a primary cause of diarrhea. However, if you notice that a room is scouring and it's uncomfortably chilly when you walk into the room, or it's less warm than the rest of your rooms, it may be something that you want to follow up on. However, in the face of diarrheal disease, piglets can become wet and chilled, and this may exacerbate the diarrhea and cause continuing problems for piglets. So if you notice that piglets are piling, if you notice that piglets are cold while they have an additional scour problem, this is part of your first line of defense treatment to try and make sure that these piglets make it through. And so go ahead and click onto slide 21. And so as we look at the different causes of diarrhea that we had, we talked about E. coli and Clostridium, which were bacterial causes of disease. And so those are going to require a bit different of a treatment protocol than, for instance, our Coccidia, which is a parasitic disease, which that's even going to require a different treatment than our swine enteric coronavirus or our rotavirus, which is a viral cause of disease. And so understanding or being able to look at the piglets and determine that this is likely a bacterial problem or this is likely E. coli will help you to implement for instance, the E. coli protocol that has been put together for the farm or the Coccidia protocol that has been put together for a farm. And so I encourage everyone to make sure that they have a valid veterinarian client-patient relationship. And that means that a veterinarian comes out to the farm routinely, which, depending on which state you're in, routinely may have a different definition. But basically, that relationship ensures that the veterinarian knows what's going on at the farm because they've done diagnostics, because they've talked to the people that are out there, because they've looked at the records. And the clients are able to give that information to the veterinarian of what they see going on, of what ages of animals are getting sick, whether or not they're dying, what kind of scour they appear to be having. And this working together and understanding what's going on, what different types of scours are going on at the farm at any different time can be very, very beneficial for raising happy and healthy pigs. And getting pigs to market efficiently. And so if you click on to the next page, these are some of the photo credits from where I found pictures of the different types of gross lesions, and they can be very helpful in looking at these different gross lesions and comparing and seeing what you've got. And then go ahead and click onto slide 23, and I am happy to take any questions that anyone has regarding different identification of scours or anything like that. Additionally, if you have any other questions that we don't answer today, I've got my email address on there, and you are welcome to email me with any questions.
Okay, thank you, Dr. Bromfield, for very thorough, informative discussion about scours. So with that, thanks again, Dr. Bromfield, for your work and your thoughts, and thanks to Sherry for putting the session together, and we'll put the third session of SowBridge to bed here. Hope you all have a good day and finish out a good week.